Good morning once again. Welcome to the new week. This is Dr. Bhupesh from Dr. BKM Institutes. Today is 24th of January, that is Monday. So we are covering this topic, which is a very simple topic. There is not much to be said, but please listen to every speaking of mine 5 times to make it worth for you. And in the exam, as always being told, there would be 3 minutes to prepare the task, जिसमें आप कुछ भी लिख सकते हो. So you can write anything over here. 5 minutes for the preparation of 5 minutes to speak the role play. 5 minutes आपको बोलना होगा. In this, examiner can be reluctant कि आप तब वो कुछ भी नहीं बोले. So you must have a practice to speak any task for 5 minutes. So it is very important to learn all these things. And the most important thing which I would like to tell you that there are no marks for the facial expressions. So audio is the only thing that is required. If you are having good audio, that means if your recording is going fine, then you don't have to worry about anything. And then the last and the most important thing is that examiner does not have any marks. He is just a patient. So please do not ask him कि मेरा पेपर कैसे हुआ. इसका नुकसान नहीं है, लेकिन ऐसे ही undue satisfaction will not take you anywhere. So just take it easy, do your best, and fluency is the most important thing. अगर आपको मार्क्स सबसे ज्यादा लेने हैं तो आपकी फ्लुएंसी और आपकी टोन बहुत इंपॉर्टेंट है. आपकी टोन पे बहुत कुछ डिपेंड करता है और आप कितने फ्लुएंट हो. फ्लुएंट जैसे कि अब मैं आपको पढ़ा रहा हूँ, तो as you can listen to my voice, after stopping, whenever I will stop, you will be able to judge कि सर ने जो भी बोला, जो भी हमारे बारे में बात हुई, जो भी जैसा भी हुआ, लेकिन हमें वो सारी चीजों पे एक चीज हुआ कि मुझे टोन बड़ी अच्छी लगी, कि सर की फ्लुएंसी बड़ी अच्छी है, कि मुझे सर की बात अच्छे से समझ आई, कि वो फ्लुएंटली बोल रहे थे. सो दिस इज द इम्प्रेशन दैट इज लेफ्ट इन द हेड ऑफ द एग्जामिनर, जो आपका मेलबोर्न में असेस करता है. तो बेसिकली वो नहीं एग्जामिनर जो पेशेंट है आपका, वो नहीं, वो इंटरलोक्यूटर है, वो नहीं. The person who will give you marks, so he will have, the first thing is your fluency, that will give you the maximum mark. Your tone, that whether you are having a nursing tone or not, that means you are confident in your tone or not, that is the second point. Grammar speaking के मामले में थोड़ा सा कम इन्फ्लुएंस डालती है, लेकिन डालती है, इसका मतलब ये नहीं है हम ग्रामर गलत कर सकते हैं, बट हाँ हमारी टोन और फ्लुएंसी बहुत, यानी हम पेपर में बैठे हैं तो हमें एज अ कॉन्फिडेंट नर्स बैठना है, क्योंकि जो ग्रामर हमें आती है अब तो आती है, जो नहीं आती तो नहीं आती. अब तो कम से कम कॉन्फिडेंस से 10 मिनट बोलना है, 5 मिनट फर्स्ट रोल प्ले, 5 मिनट सेकंड रोल प्ले. So be confident about yourself and be the best nurse you can while taking your OET speaking exam. So I'm just going to read the task for you and will tell you how to execute. You are a head nurse. You are attending on a patient who has undergone an operation for the thyroid gland removal. So patient has undergone the operation. That means वो करवा चुका है. The patient is unable to speak properly and she has difficulty in swallowing or even breathing properly. So she is unable to breathe properly or swallowing very properly. Begin with the warm greetings. Answer question that she may ask. Assure that her problems related to speaking, swallowing, breathing will go away sooner. Usually they go away in 2 to 3 weeks. Advise her not to pressurize her vocal cords by speaking continuously. Suggest to elevate her head all the times for 4 to 5 days after even while speaking. So मैं अब इस रोल प्ले को ऐसे करूंगा कि जैसे एग्जामिनर रिलक्टेंट है. So good morning, my name is Bhupesh. I'm your charge nurse for the day. So how are you feeling now? All right, nurse, like I can't speak. I'm feeling too bad. See, I understand as you have recently undergone an operation for the thyroid gland removal. So obviously I understand that you will not be able to speak properly, but don't worry. After some times, after a couple of weeks, you are expected to speak properly. We have seen patients recovering from after the thyroid gland removal usually are able to speak after 2 to 3 weeks. So there is nothing to worry. I totally understand that at this point of time, you might be having trouble in speaking. Yes, nurse, swallowing, I can't eat anything. I can't breathe properly. But please, nurse, help me. I'm really scared. Well, please don't worry. I understand your anxiety. I know you are concerned about your health. And at the same time, at this moment, you must be very concerned that you are unable to speak, breathe, and even you are unable to swallow. That is why doctor has recommended you blend diet. That means at this point of time, you are not supposed to eat anything solid, because obviously you will have a lot more difficulties in swallowing. In the initial stages, of course, we are giving you IV. So at this point of time, you are not supposed to take anything orally. So please do not worry. But after some time, when you will be able to allow to eat from your mouth, it will go one by one. First of all, we will start up with the liquid diet, then we will start the blend diet, and then ultimately after 2 to 3 weeks, you will be kept on the solid diet. So that is how the things will change. So please be patient, as you need to have that patience, at that element of patience for now, because it is very important for your recovery. Because after any operation, if you take stress, it becomes difficult for the patient to recover sooner. So if you want to recover sooner, please do not take any stress and relax yourself. We assure you that you would be able to resume your speaking properly, and also your swallowing function will be as good as it used to be before this operation. Well, nurse, thank you for assurance. I'm feeling a little better after listening to you. Also, you mentioned about the breathing problems. Don't worry, this breathing problem will also go away, because right now you are having this problem of thyroid gland removal. So things, there might be many inflammatory things in around your throat. So please don't worry, everything will become normal after some time. So usually the healing takes, after the thyroid gland removal, the usual time of recovery is around 2 to 3 weeks. So you would be absolutely fine after 2 to 3 weeks. Also, I would like to tell you that as you are trying to speak, and so it puts lot of pressure on your vocal cords, so please do not speak with anyone, especially continuously. So you are not allowed to speak to anyone continuously, and for the time being you can speak little, but please do not over try, because it puts lot of pressure on the vocal cords. So at this point of time, doing anything as such can be dangerous. So please avoid any talks which are not important, and most importantly, please put your mobile phone away, and do not try to talk over the mobile phone. Your friends are here, your relatives are here, they will attend you and they will help you with anything. So please do not try yourself to speak anything which can put pressure on vocal cords. Last and the most important thing I would like to tell you is keep your head elevated at all the times for the first 4 to 5 days after the surgery. As you have just undergone the operation, so at this point of time it is very important for you to keep your head up all the times for the first 4 5 days, and then you will start feeling better. And even while you are sleeping, keep your head up. So basically you can put the pillow underneath, or maybe you can elevate your bed and can keep it at a certain angulation, but please do not lie straight, it's not really good for you at this moment. So I would like to highlight the key points so that you can feel easier that your speaking function, your swallowing function, your breathing difficulties will go away, and the functions will be resumed normally within 2 to 3 weeks. And do not put pressure on your vocal cords by speaking continuously. And the third thing is keep your head elevated. So all these things will really help you to recover faster. This is Bhupesh once again. And if you need anything, please press the buzzer beside your bed. Somebody would be here to help you, as we all are here to provide you the best services. And there is nothing to worry, you will be absolutely fine within a couple of weeks. Is it all good? Yes, nurse. Okay, take care. Thank you. So this is how you execute your role play. So the people who have any kind of challenges, who have any kind of problems, so please do not worry, just listen to this recording 5 10 times. It obviously will resolve your problem. एंड अगेन जब आप एक बार सुनोगे तो आपको ये समझ आएगा कि सर अच्छा बोलते हैं. अगेन दैट इज द ओनली थिंग यू गेट आफ्टर लिसनिंग वंस. But after listening 2 times, 3 times, 4 times, you will start feeling more stronger, more potent. And these things will help you to prepare your OET task effectively. So please keep listening to the speakings for like 5 times at least. एक speaking को 5 बार. Thank you so much.
Please like, subscribe, and hit the bell icons for the free OET coaching videos.